right? So outside of the family, maybe there are things we can do. I mentioned before that there's a powerful link between social disadvantage and mental health problems. About half of the reason that a child will develop a mental health difficulty can be explained by the degree of social disadvantage that they're experiencing in their contexts. Okay? It's not the whole story, but it's an important part of it. So there are policy implications there for how we support families experiencing social disadvantage. We know that positive peers matter, both in terms of protective kind of factors as well as in terms of helping after mental health problems develop. Inclusive education, there's a real challenge around inclusive education of ensuring that the outcome of inclusion is meaningful social inclusion, not just physical inclusion. We know that as kids get older within the school system, they're more likely to experience fewer reciprocal interactions or relationships. They're less likely to experience acceptance, more isolation, and being on the periphery of their social world. So how do we address that? That's not treating the individual, that's not targeting the family. But if you were living and growing up in a school system where you were really on the outs all the time, is that going to predispose or perhaps precipitate mental health difficulties? There's a quote that came out of this study by Connie Kasari and others that said, promoting children with ASD's skills in popular activities to share with peers in early childhood may be a key preventative intervention. Okay? So it's not just about the individual, right? But it's about how that they interact with their peers and how those peers interact with them, right? It's about an experience of kind of meaningful involvement and whatever that means. I'm going to see if this one works here. This is a news clip that I've presented before, and if not, we'll just kind of move on. Okay. So it doesn't work. So I'm going to walk you through what this is. There's a great news clip that was presented of a young man with autism who was really isolated and withdrawn, and what happens is he finds out that he's interested in being the school mascot. And this is in like some town in the US where it's like Friday Night Lights, where like the high school football team is like, everybody is interested in this kind of experience, right? Everybody's interested in here. And he wants to actually be the mascot. His parents talk about how at first they were really reticent. They were worried that he'd get made fun of or that something bad would happen. He had a lot of needs. But they said, okay, fine, he wants to do it. Right? And he actually ends up becoming the center of kind of the experience of these Friday night games. People are high-fiving him in the halls. He's found a role that he's proud of, and that's socially actually quite acceptable to the people in this community. This is not like I'm going to recommend that people in my care become mascots, right? There's no way I could have thought of this as a clinician that this is the kind of treatment that would have helped bring joy and positivity to this young man's life. But it's part of that equation. Some of the work that we have done has studied things like Special Olympics and how we've given cameras, disposable cameras, to athletes who have intellectual disability and with autism. And we've taught them how to use those cameras to take pictures of what's meaningful to them in their participation in Special Olympics. And the vast majority of the pictures have nothing to do with actually the sport and have to do with the social experience of what they're doing in their own way. There are also pictures of their medals and their achievements, right? So that's also part of it. But there's a sense that this goes beyond physical training, that what they're getting out of this is meaningful for so many other reasons, for mental health reasons. I know that mentorship programs have popped up across the country. Right? Mentorship programs are helping the individual, but they're not focusing on the individual. Mentorship programs are creating a context where individuals can thrive. So just as an example, I know at SFU there's a mentorship program, right? At York we have a mentorship program. They've come up all over the place, and they all look very different. But the point here is that we're starting to actually shape the environment. We're focused on equipping peers to be part of the solution. We're teaching peers how to be the right kind of peer to create an environment where people thrive. Creating situations like Scouts and making sure Scouts and other kind of commonly available kind of public activities are accessible to people with autism. The intervention here is about working with the Scout unit and the Scoutmaster, right? Creating a situation, a context where this child can participate in a meaningful way. So I talked about Special Olympics and our photo elicitation work. We've presented this before. We know that recreational activities are really important. One study that I'll share with you, there was a randomized controlled trial of having kids participate in teens participate in either cognitive behavior therapy, group CBT for anxiety, or participate in a social recreation program. Okay? Which one do you think showed the stronger effects? Okay, who here thinks it's the CBT? Who here thinks it's the, you know what I'm going to say, who here thinks it's the social rec program? Okay, you knew, you're reading my body clues, right? In actual fact, both groups were equally as effective, okay, as getting nothing, right? Both groups were effective in terms of the same percentage of adolescents made meaningful gains and reductions in anxiety. One had both, they shared a common experience, they were both structured, they were both social, they were both positive, they both were facilitated, but they had very different kind of content areas, right? And both benefited, not everybody who participated, but benefited some of the participants, or equal numbers. So maybe we don't need special interventions that target the individual in treatment per se, if we can create or foster broader kind of support programs that involve many people that are part of our kind of daily context. When we think about mental health, let's also talk about post-secondary for a second. We have to think about mental health over time, not just mental health in the present moment. You know, moving from a high school situation to post-secondary experiences, there's increasing focus on what's going to happen after, right? What's going to happen, what kind of meaningful vocational opportunities, volunteerism or group work or individual work will I be able to do? What's going to get me out of my basement? Okay? The intervention there, often we talk about building employment skills and readiness skills. That's focused on the individual, but we also know that that's not enough, right? We have to help coach the job site. We have to help create those kind of scaffolded job situations in this example for that person to engage with. We have to treat the employer in that way or intervene with the employer. Whether it's something like learning how to cook and then having a placement where a person gets to go to exercise that and creating those kind of places in the environment. Or working even within hospitals to capitalize on a strength. You know, a young man without any with little verbal skills might still do extremely well in this environment, sorting or selecting as an example. Okay, finding the right fit. So here we're working with kind of the HR department, right, of that kind of place. There's no one intervention or one solution, but I would suggest that all of these are part of our conversation of mental health and autism. So where do we go from here? What do we target? Is it the individual or the family? Is it the broader kind of environment or even society at large, right? There was considerable work, I used to talk a lot about this, less so in recent years, of the impact of stigma, right? And on a person's development and their psyche, right? And stigma is something that is not focused on the individual, but it's something really shared by society in terms of a responsibility to address. We're moving beyond acceptance, beyond awareness to acceptance. And in some cases, we're moving beyond acceptance to appreciation. Right? But we're not there yet. I used to put up this thing, Google created this great kind of thing for a while where they tracked how many times the R word was used on any website you could enter. So it would tell you on Facebook how many times the R word had been used. And it's amazing how many times it still pops up on social media, how it's alive and well. That's not directed specifically at autism, but it's how we have as a society a message around difference, a message about neurodifference or neurodisability, and what it means to be valued when we use pejorative terms like that. Those messages trickle down, right? Those messages resonate at some level. So, and that's a responsibility or an intervention. If we're going to intervene there, it's not just on that young person who used the R word that once on social media, is it? That's not how we can solve that kind of problem. We have to intervene at society in a much broader sense, right, in terms of how we create messaging and what we value, right, as a society. So, where do we go from here, right? We're at this crossroads, this conference for the rest of the conference kind of today and tomorrow, where you're going to talk about different kinds of, or learn about different kinds of interventions. You're going to have sidebar conversations about specific people or about what you've tried or what has and hasn't worked. Think about the kind of the four corners, so to speak. Think about what kind of aspect of your conversations have to do with the individual or the family, or maybe if the broader environment or society is missing from that, right? Let's get a holistic kind of picture of what it means to treat mental health and autism. I think that's the only way that we're actually going to solve the kind of my first few slides of addressing that much higher risk over time. Okay? So that's me on my soapbox for the keynote. These are all my bosses, as kind of was mentioned before. I hold this kind of research chair for 6 more months, and then the research chair will be up. So this is a research chair that's funded by CIHR, but with a lot of partners involved. Kids Brain Health, Autism Speaks Canada, Cine Family Foundation, a number of different, as well as the Canadian Autism Spectrum Disorders Alliance. The last thing I'll say, because I know we have to have some time for questions, is that if you want to know more about ASD and mental health and keep the conversation going, we have an ASD mental health blog that you guys can check out. Just Google ASD mental health and it'll come up. Unfortunately, it's one of the only things that comes up in terms of ASD mental health blog. It's the first one on Google that comes up. We also have a TEDx Salon event that we've carried last year, and we just finished our another one where we had speakers with autism, family members, service providers, all speak about what they think is needed to improve the care of Canadians on the spectrum. So those are on our YouTube channel that you kind of see here, so you can check out those TED Talks as well. And there's my email address if you want to email me afterwards. Thanks very much.